Hi, I'm Dr. Bill Monacci, neurosurgeon with Lancaster County Neuroscience. I came to Lancaster County in 2006 after a career with the military. I started my education at the United States Military Academy, graduating in 1983. I subsequently went to medical school at the Uniformed Services University in Bethesda, Maryland, finishing my education in 1987. I subsequently began my neurosurgical training with an internship in general surgery at Walter Reed Army Medical Center. That was a one-year training program, and subsequently entered the Walter Reed Neurosurgery training program, which lasted 7 years. I finished my education in neurosurgery and subsequently did a year-long fellowship specializing in cranial-based tumors at George Washington University. During my residency, I completed a fellowship at the National Institutes of Health, again dealing with care of patients and tumor research. During my career with the military, I held several positions. I was the assistant chief of neurosurgery for several years. I also held a position as neurosurgery consultant to the Surgeon General for 6 years prior to my finishing my time with the military. That involved working with the neurosurgeon on deploying and training our neurosurgeons, also coordinating neurosurgical care in the combat theater. I also served as director of the skull base neurosurgery lab and also held a position as assistant professor of neurosurgery at the Uniformed Services University of the Health Sciences, where I graduated. When I finished my time in the military in 2006, I sought out positions in private practice. I grew up in Pennsylvania in Bucks County and finished my high school time at Archbishop Wood High School. I wanted to return to the Pennsylvania area and looked at various positions that were available. I wanted a place that I could raise my family, that was a tight-knit community with a lot of the amenities that a medium-sized city could offer. Lancaster Neuroscience filled those requirements very nicely. I especially was attracted to Lancaster Neuroscience because of the physicians themselves. They were a close-knit group of physicians who practiced similarly and were proponents of taking care of the community as well as practicing excellent medicine. I was also attracted by Lancaster General Hospital and the other surrounding hospitals in that they provided quality and state-of-the-art care, which I was used to from my career in the military. The physicians at Lancaster Neuroscience and Spine Associates are not only devoted to providing excellent health care, but also providing service to the community. The practice is engaged in supporting many events throughout the community and also engage not only the medical aspects of the community, but also public service. The facilities, the healthcare facilities in the area, to include Lancaster General Health, provide excellent high-quality health care and are devoted toward providing state-of-the-art care, not only in neurosurgery, but all specialties. It was clear from my experience initially that all specialties were well represented, and each physician was dedicated toward the high level of service that I had come to expect from my experience in the military. I became a physician for a variety of reasons. I started out at West Point as a nuclear engineer, but I'd always thought about medicine, and if you think about it, neurosurgery and engineering have similar backgrounds. Each looks at a system and tries to intervene to make it better. The practice of medicine has the added advantage of being able to help people, and direct intervention through surgery can help people most directly. Neurosurgery is still in its infancy in terms of its understanding of the nervous system and how the brain works. Thus, advances are made daily in our specialty. which is unique, I think, among many of the specialties. So that attracted me toward neurosurgery specifically. As a neurosurgeon, I provide the full spectrum of neurosurgical care, not only spine surgery and peripheral nerve surgery such as carpal tunnel or ulnar nerve disorders, but also the practice of tumor surgery, which I devoted a significant portion of my career toward perfecting. I was the main tumor surgeon at Walter Reed Army Medical Center while I was there. I also engaged in a fellowship which instructed me directly on various ways of operating on highly complex tumors. Therefore, I think although I do perform all activities as a neurosurgeon, I do enjoy tumor surgery given its complexity and its importance to provide a good outcome. Neurosurgery poses many challenges and therefore has many rewards. Among the challenges include figuring out exactly what is causing each patient's problem. Frequently, it's not as easy as getting an MRI or even doing an exam. There are several components of neurosurgical care that demand the neurosurgeon act as a detective to try to figure out specifically what's wrong with that individual and what treatment will best help that individual. With neurosurgery, you take a direct intervention. If somebody has a tumor, removing that tumor can frequently alleviate all the symptoms that the patient presented with. For other more subtle problems, such as a painful condition of the neck or back, other interventions may be required, and many don't involve surgery. Outside of neurosurgery, I have several interests. I have a wife and 4 daughters. We love exploring Lancaster County. It's a beautiful area in which to be outside. There are several aspects of the culture which are very interesting. There are always new things to see. We engage the various community activities, taking in plays at the Fulton Opera, eating at several of the restaurants in town. It's a great place to raise a family.